Good afternoon, everyone, and welcome to Emory's MCI Dementia webinar series. We are so glad you could join us today. This webinar is a part of an educational series that is sponsored by Georgia MemoryNet, Integrated Memory Care, the Emory Cognitive Neurology Clinic, and the Charlie and Harriet Schaefer Cognitive Empowerment Program. Each month, we have a different topic that relates to cognitive health, dementia care, support, community resources, just to name a few. The previous webinars have been recorded and can be viewed on a link that will be placed in the chat during the presentation. I am Alice Cooper Salisbury, one of the licensed clinical social workers in the Cognitive Neurology Clinic, and I'm joined by my social work colleagues, Jenny Gay in IMC and Debbie Arnold in CEP. But first, a few housekeeping details. This is a webinar format, which means your cameras are off and your mics are muted. We do want you to be able to participate though. So if you have questions, please put your questions in the Q&A box throughout the presentation. We will save time at the end for our speaker to answer them. Please note, again, you do not have to wait till the end to put your questions in the Q&A box. On that note, we have a treat for you today. Our very own Debbie Arnold will be presenting, and I am going to let her introduce herself.
Okay, well, I will go ahead and share my PowerPoint and make sure that technology is cooperating today. And I hope y'all can see my slides. Today I'll be talking about a framework for celebrating special occasions with mild cognitive impairment or early stage dementia. And in my role over here at the Cognitive Empowerment Program, I lead sessions that really focus on managing the impact of neurocognitive issues on a person's identity, their relationships, and their overall quality of life. I have a varied background in many settings. I've been the social worker in geriatrics. I've worked at an elder law firm as a care coordinator, but working at the Charlie and Harriet Schaefer Cognitive Empowerment Program is just a really phenomenal way of learning more about what families need to really live well, even when cognitive impairment has been diagnosed. So that's where I'm coming from today. And let me see if I can get my slides to advance, which I am not sure that it's willing to do. Let's see. There we go. The benefits of having a daily routine and structure are especially important for people who are having issues processing information, right? We know that nobody needs the stress of having to look for their keys. So leaving your keys on the same hook each time is really important. And routine and schedule really lend some predictability to days. And we all function much better overall if we generally go to bed at the same time and we wake up at the same time each day. So that being said, special occasions and holidays add life to our days, and we want for people to continue to be able to participate and engage in family life and in the special occasions, even after a diagnosis of a cognitive issue. And I do also want to say that this is not exactly a lecture because I am not an expert on your life, and I can't tell you what would work well in the context of your family. But I did just want to provide some guidance for a way of thinking about these things and of really considering ahead of time before the holidays get here, what's most important and how you're going to be celebrating. And despite this winter wonderland background of my slides, I'm hoping that my guidance will be useful, not just for the winter holidays, but really generalized to any gatherings or special occasions that you have coming up, family reunions, big birthdays or anniversaries, things like that. So, these holidays and special occasions can be equal parts joyful and stressful. Complicated feelings, including more than a few shades of the blues, often do show up. So, what complicated feelings means is also going to mean different things to each of us. There may be some subtle, maybe not so subtle pressure to be grateful, joyous, for everything to be sparkly and bright. And if we're not feeling, you know, extreme levels of gratitude or feeling jolly and bright, we might feel guilty or, what the heck is wrong with me kind of feelings. We also might miss the people that we wish that we could celebrate with together if they're not available for one reason or another. Sometimes it's the first holiday after losing a loved one. Oops. Or sometimes it's just distance that makes it so that we cannot be together. So consider what celebrations have always been your favorites, and in those, what particular traditions or rituals, or even specific foods, seem to make or break these special occasions. When and how different folks celebrate is very individualized. There might be foods, songs, or prayers that are unique to your heritage. When and how gifts are exchanged varies, quite a bit. But think in terms of like, it's just not Thanksgiving without that green bean casserole, or if we don't go and see the lights, so and so place, or maybe if we don't make it to this midnight mass or something like that. Try to consider when you think about the holiday or the special occasion, what comes to mind? What are the things that really are meaningful to you? And with that, if we can't do every single aspect, what do we want to make sure we preserve or try to make accommodations to still be able to enjoy? Um, we also want to consider whether and how cognitive issues may already have impacted some gatherings. Since we're not just talking about the winter holidays in December, it can be helpful to think of some recent celebrations or times that you've been together. What went well and what maybe there was some room for improvement. Um, and when you consider these things, I want you to really pay attention to not just the reality of the occasion, but also how stressful was it? What were some of the things that maybe you worried about that didn't even come to pass? But those what ifs are, they do factor in. And, maybe you were concerned about being able to call everybody by their correct name, and you worked so hard at remembering names that it was hard to enjoy much else. Or maybe you're a care partner and you're supporting somebody that has, a little bit of impulsivity or new and different, what we call disinhibition. And maybe it went fine and your person didn't do or say anything that offended anybody, but you were anxious and exhausted after the fact from that what if this happens. And so going into planning for a special occasion, really pay attention to the things that concern you and try to diffuse them ahead of time as much as possible. Because being proactive means being able to show up on the day and just be present. Some families also tell us they basically have two sets of loved ones or friends. There are the ones that they've told about the diagnosis. Maybe they've even done their own research or reading, and they get it. If there's a hiccup, y'all can laugh about it together. Um, and then there are the other people, the people that you work really hard to maintain this veneer of all is well. And that is exhausting, right? A secret has power just by being a secret. And so we want to limit the amount of energy that you have to spend maintaining the veneer and cracking underneath, right? So my guidance is really to plan ahead because that's how we avoid as much stress as it's possible to avoid, and also show up that day and be present. So avoiding means setting aside time that you can shop, time to cook, and time to visit. It's probably not realistic to multitask all of those things, right? And cognitive changes make multitasking even less realistic than it is already. Travel, I mean, you look up travel in the dictionary and it just, it's stress. Consider peak days and times and really try to be realistic about getting to the place that you'll be celebrating, and maybe plan to be early so that you're not already exhausted by the time of the celebration. You know yourself and the person you support best, but try to be mindful that comfort zones can shift. We all have a comfort zone, and different things play into that comfort zone. Excuse me. Neurocognitive decline generally means a comfort zone gets narrower. So whatever the usual suspects are that make things challenging, those things are going to show up earlier and more often. So say I'm a person that doesn't do well if I'm too hot or too cold. Well, that range of temperature may only narrow. So I need to maybe be sure to wear layers or have an opportunity to go out and get some fresh air wherever I am, so that I can enjoy myself, whatever that comfort zone might mean. And maybe consider what factors do contribute to how comfortable a social setting is now. It might be the time of day, it might be the driving distance, maybe it's the number of guests, and try to problem solve beforehand. If possible, when you make decisions about who will host and how many people you really realistically want to spend time with at a visit. Care partners also have comfort zones and run out of steam. So this myth of care partners being an endless well of patience and giving is a myth. And we have to be realistic and protect ourselves if we're a care partner. So the ABCs of holiday self-care. And again, not just at the holidays, right? But being aware of how you feel and checking in with yourself so that you're not waiting until you're undeniably overwhelmed before you siphon off a little steam or stress. You have to check in with yourself often and really be aware of what your signs are personally that I'm getting done. I feel that I'm clutching the steering wheel, or my shoulders are up around my ears, or maybe I want to tell somebody to hush and they're not even talking to me right now. It's just that look on their face. And you know that you're getting irritable and a little bit peopled out. So siphoning it off a little at a time, taking breaks is really, really important. So balance, I'm talking about balancing as many areas as possible. So socializing or structured activity, work, travel versus downtime to rest and relax. But also balance between connecting with other people and connecting with yourself. Um, it's important to get honest about the needs of the person living with a cognitive impairment being slightly different than the needs of the care partner now. And in order for you to both feel that you've had a successful day, sometimes some dividing and conquering is important. So, for example, if the care partner's childhood friend is in town and the window that they have available to visit is late in the evening after you've already been visiting with people all day, then maybe the most realistic thing to do is for the person with the diagnosis to have other companionship in the evening, if possible, so that the care partner can have a quality visit with their childhood friend. And you know what's going to work for you and your person, and who you might be able to delegate to as well. Or maybe it's fine for them to spend some time alone. Many of our folks with MCI who participate in the cognitive empowerment program are perfectly safe to be, on their own for a few hours in the evening. I'm also talking about, giving yourself grace. So giving yourself permission to take a break without calling it defeat. And I mean this for the folks who have some cognitive issues and also for care partners. Whether you have a cognitive impairment or not, human beings sometimes need to unplug in order to function better. And, when we're running on empty, we're all kind of feeling like 2-year-olds in need of a nap. And it's not fun to be around me when I'm like that. You can ask my family. So I mentioned early on here that various shades of the blues typically show up at the holiday time. And it's different for each individual, but here are some common reasons that we get stressed out during the holidays time. We call them the 4 F's. So the fantasies, the family, the food, and the finances. And I'm going to talk about some suggestions to cope with the specifics of each kind of stress. So the fantasies I'm talking about are, those magical memories that distance and time have lent enchantment to, right? When we think back to the holidays of our childhood. Everything has a rosy glow or a frosting of snow. Everybody was happy, and it all looks like the Norman Rockwell picture, whether or not that was reality at the time. And you know, it's really not possible to react the holidays of past days. We can't resurrect folks that we've lost, and we can't always return to the scene of the Norman Rockwell, meal. And I think it is possible to embrace our memories and tell our stories without kind of maniacally clinging to and trying to recreate those things. We can try some new routines or rituals out without devaluing the things that have gone before. And I think the key there is to allow time and room for feelings, to talk to the other folks about how do they remember the past, or what was their favorite part of, some earlier celebrations, and building in some new things and seeing how they go. Um, for many people, family is really hard to define or describe, right? We have separated families, we have blended families, we have interfaith families. Uh, People have a chosen family. Some of us have two for the price of one kind of families after a separation or divorce. And it's really not unusual for conflicts to erupt, for cues to be misread. A time apart may make time together more intense. Sometimes we feel like we're always 7 years old when we're around a certain group of people. And it's hard to move past those established patterns in the past. Um, I think that my advice for coping here is to just really try to sweep your own side of the street and bear in mind that you cannot control someone else's behavior, but you do have agency over your own, up to and including being done or taking breaks. Feelings of loneliness or loss may show up uninvited. These are really normal at the holidays. And sometimes the antidote is volunteering with people who are less fortunate and don't have a support system or a holiday meal to attend themselves. But seeking community is often a way of, supporting yourself. So don't forget that support groups exist, that the Alzheimer's Association has a 24-hour hotline, and that you don't need to go it alone. As far as food, you know, overdoing comfort foods leads to discomfort, right? Skipping your healthy food and exercise habits that you're accustomed to doesn't really mean it's a treat. The day after Thanksgiving, emergency rooms are full of people who have been really diligent about their low sodium diet, but departed from that for the holiday meal and really are paying the price. It can be life-threatening, quite honestly. But even if it's not to that degree, here at the Cognitive Empowerment Program, we're really talking about lifestyle habits as a way to be and feel your best. So good self-care, really means remaining on track with only small detours. It's moderation is the not so secret, right? And if you know that you're going to be tempted with a lot of things that are really not on the mind diet or not on the list of things that you're trying to eat more of. Maybe have a healthier snack or meal before you attend a gathering, and then you eat lightly and enjoy a little dessert. And the real point of being together is the seeing everyone and, celebrating together. It doesn't mean you have to eat every single thing. Number four, the seasonal consumerism of finances. A lot of people are really struggling financially now. And this is always true at the holiday season, but it's even more true right now. And try and really place the value on being present versus exchanging presents. We know that we all get a case of the gimme gotchas at this time of year. We feel guilty or anxious about money, and that can zap the joy out of anything. But, just try and get a hold of yourself and your loved ones and recall that we can't buy happiness, but we can be happy even with a pretty sparse table or fewer things under the tree. We can enjoy each other's company and celebrate the special times together. If you are feeling persistently sad, irritable, or hopeless in a way that maybe is a little bit more than the usual holiday blues, and this can also be exacerbated or made worse by the shorter daylight hours this season. Seasonal affective disorder is a kind of depression, and it is real. If you are really struggling with symptoms of anxiety or depression, please take this seriously and report it to your provider because it's treatable. And for many folks with mild cognitive impairment, participating in counseling or support group, or even taking an antidepressant is, completely safe and effective. So. So where do family and friends fit in? And spoiler, I have two slides that will ask this same question. So the first question is, do you or your spouse or your kids maybe feel compelled to continue doing things in a way that are not a good fit? And we do this for a variety of reasons, right? To continue traditions, right? It's not a tradition if we don't continue it. To keep the peace, right? Because we just don't want to even have that conversation. It'll be a difficult, unpleasant conversation. Change may be hard on other people. Maybe we're just really invested in maintaining this picture that all is well, right? No change here for as long as possible. So I think what I want you to know is that even for individuals or families where cognitive impairment is not a factor, sometimes people continue doing things that are not a great fit for all of these same reasons. And for this last one, I think it's important to consider what the talk in your head is all about, right? Sometimes when we have more uncertainty about the future and fear that a condition may progress, it feels like the stakes are especially high for this holiday, right? And I think it's important to get honest about that and to have that conversation. For the person with a neurocognitive disease, the present moment is always the priority. We're not so much creating memories as we are creating moments of joy and connection. So looking forward sometimes results in more anxiety, and even the most sparkly holidays may not be remembered. So we do want to take some photos, and we do want to savor the moment. Um, but but all the planning in the world doesn't change the fact of the diagnosis. So focusing on, if you take one thing away, it's this focus on the comfort zone and finding these moments of joy and connection that really get both the individual with the diagnosis and the care partner through holidays with the most joy and the least stress. So here's the second one. Where do family and friends fit in? Part two. Maybe you'll be seeing some people for the first time in a long while. And if that's the case, it might be important for them to know that there have been some cognitive changes. Um, we all probably prefer to have that big C conversation in person, but that might not be realistic at a big gathering, and it might not be the best scenario for the person with the diagnosis. So in some cases, planning ahead might mean a phone call or an email to multiple people so that everybody has the same information before the get together. And especially if you're going to somebody else's home and the host might not be aware of what you're dealing with, it might be helpful to give them a heads up and consider asking for some accommodations, just as you would if you're having more trouble with steps and you're using a cane now. You would let them know or ask if there's a different entrance that's a little bit more accessible. Asking, maybe the person I support would really benefit from having a quiet corner with a photo album in case they need a break. And so asking for that ahead of time, even if you never end up needing it, it just might feel like an ace in the hole. And planning ahead might also mean the individual with cognitive impairment and the care partner agree on, what's one or two sentences that we're comfortable saying. I'm having a little difficulty with my memory now, or I'm having more trouble with names. And you don't have to give them access to your My Chart and every detail about your diagnosis. It's enough to just let them know, I'm dealing with this and move on. So it's important to remember also that just because people love you doesn't mean they know how to talk about these conditions. And people will say dumb things consciously or unconsciously, or they might say nothing and they're sort of waiting for permission to even acknowledge that there are some cognitive changes. But what we really find is that once some conversations happen, that opens the door to educating other people more about these conditions, to referring people to reputable sources of information. And that's what is going to eliminate the stigma and the mistaken beliefs about cognitive impairment, because we know that the truth is we don't want people with a cognitive impairment to be hidden away. It's very important to engage in relationships and spend time with people who care about you. And that's only possible if we correct some of these myths and misconceptions about early stage dementia and mild cognitive impairment. So that's where the second one also it becomes more important, that maybe once we educate others, we have more of a support system available. There might be other people who are going to ask, well, how can I help? Or what do you need? And maybe you have the answer ready. My childhood friend is in town, and it would be great if you could spend time so that I can go meet them. So changes might happen, but they don't all happen to us, right? We can plan ahead and make some conscious decisions. We give ourselves a little grace at this time of year. It's not necessary that everything is homemade and on the holiday china, right? Maybe the holiday china is important, but having a platter and a gravy boat can represent the whole set of china, and otherwise it's okay to use disposables and save the planet next month. If you host, try to be prepared for people to ask what they can do or what they can bring. I tell care partners all the time that asking for or accepting help is a learned behavior. It's something that we have to practice in order to get more comfortable with that. So even if it's not in your nature to have a potluck situation and you want to make everything homemade, see what it feels like to ask people to, bring a dessert or, you know, things like that. And maybe consider some creative scenarios ahead of time. Maybe we have the meal at one home and then we go to somebody else's place for dessert. Or we don't have to have a big meal. We can meet a little earlier and have mocktails and heavy hors d'oeuvres because the real point was to be together anyway. Um, so I'm gonna, in the interest of time, I'm gonna skip a little bit ahead. So this slide I love this slide. I think it was a picture that was in the AJC a couple years back about forging new traditions. And what I want to talk about here is the balance between the way in which rituals and traditions really connect our present to our past, but also we can update some of our traditions in a way that works well for us now. And being realistic about whether observing a certain tradition is meaningful now is hard. But forging new traditions is not as hard as it sounds, right? That sounds like I'm in the garage with tools and, molten lava or metal or something like that. But it's really not, it's not that complicated. Forging new traditions generally means making only some minor modifications to the way we've always done things, an existing practice. A good example of this is celebrating the new year at noon. So we say Happy Noon Year. And, we know that it's already the next year in Australia. It's not going to be the next year in Hawaii quite yet. So when we celebrate is a little bit arbitrary to begin with. And if you don't choose to be on the road at night with a bunch of people who have been drinking, celebrating Happy Noon Year, makes all kinds of sense. That's just one example that I kind of liked, but really I'm talking about trying to be realistic, right? Trying to consider after Thanksgiving, really taking a hard look at how did that go? What was fun about it, and what would I not choose to repeat? And then going into the December holidays, armed with that information and a sense of, we can do this and we can do it better, and make everybody a little bit more comfortable. Because people with neurocognitive disease really can continue to experience joy and connection and celebrate the good times. And so can their care partners. So that's what I've got. And I'm gonna unshare my screen. Okay.
Thank you so much, Debbie. I think Jenny's gonna
So much, Debbie.
have questions.
All right. Well, I don't know if anybody has.
I don't see any so far. So y'all, after that great presentation, thank you so much again, Debbie. Please feel free to put your questions in the chat, or sorry, in the Q&A, and we will get them answered. And Debbie has a short period of time to answer questions. So please go ahead and let's get those in if anybody has those questions. Alice has also just put the link for the previous recordings into the chat if anybody is looking for that link as well. Thanks, Alice. We got one. I was gonna ask one, but we got one. They asked, do you have advice for prepping small children for time with grandparents who have cognitive changes? That's a great question.
Yeah, so I think considering how the cognitive changes may show up, and preparing the children ahead of time, and it's going to depend, on their age, and sometimes we feel like we have to over prepare kids, and kids will just let you know what's most important to them. But sometimes things like music are a really wonderful way to connect, because our songs tend to stay intact much longer. And so singing songs together as a family is a really good way to connect with the younger ones and also honor traditions. And also, really just considering what they need to know. If Papa calls you by the wrong name, it doesn't mean anything about how much he loves you. He's having some trouble with names these days. You don't have to name a diagnosis. You don't have to talk about it, ad nauseum. It's really just letting the child know that they are important, and and sometimes the kids will just really surprise you and rise to the occasion in a lovely way.
I really agree with that. I think children tend to be, a little more uninhibited and are still pushing limits and learning about things. And so I think so many adults and people generally being around someone that they have knowledge has dementia can make them very nervous or very anxious that they're going to say the wrong thing or not approach things the right way. And I find that with children, there's not that hesitation. So in some ways, sometimes it's a really good thing. I think some of the primary challenges tend to be overstimulation with noise, especially with younger, louder children. So we have recommended for some of our patients to get some good noise canceling headphones or earbuds, to designate a space in the home for them to take a break if they become agitated by that. And then there are also some excellent children's books about having a loved one with dementia and what that means and what that looks like. Most of them are geared towards grandparents, I would say, but those can be really helpful as well.
Excellent guidance. Thanks, Jenny.
Yeah, of course. All right. You are so welcome, Kelly. Debbie, I know we just have one more minute before you have to hop off. So I don't see any more questions right now. And Alice and I are happy to stay on for a couple more minutes.
If you're
Other
at
people
cohort
have
40,
other
you're
questions.
going to the wealth in the library. If you're
I'm
at cohort
sorry.
40,
So we'll stay on for a couple of minutes to allow folks to ask a couple of other questions if they have them. Obviously, this is Debbie's presentation, but we all kind of work in this space together. So we have got some guidance to offer as well. And Debbie, thank you for this awesome presentation, super helpful. And I think it's something I'll be encouraging a lot of our families to watch prior to the holidays. So.
Thanks, Jenny.
Thanks, Debbie.
Bye, y'all. Sorry I have to jump off today.
Okay. The next question I see is, when I have shared my husband's diagnosis, people react differently. Any help to improve understanding? That's a very difficult position to be in, and something that I think is really vulnerable to share already. And when it's not received well, sometimes it can make us hesitant to share it again. So first of all, I think it's really brave that you've been willing to share that information, to seek out support and increased comfort with those surrounding you and your husband. I think having the conversations ahead of time, and I think just being really transparent and human about it and sharing that, you know, and I've shared this in the past with you or others, it seems like it's made people really uncomfortable, which is really difficult for me. And I want to make this experience as positive as I can for everyone. These are some things I have found that really help me to be with my husband, to communicate with them, and also just to say, I give you grace. You know, I don't expect you to be a dementia expert or to know exactly how to maneuver a situation. The fact that you want to spend time with us is meaningful. And so even if you don't say the right thing or something happens, please know that you're given unlimited grace and that we're a safe space to be in. That's how I encourage people. Alice, I don't know if you have any additional.
No, I agree. I think just being able to point them in the direction of education,
Yeah.
and letting them know that there are spaces that they can go, like the Alzheimer's Association, to where they can actually talk with someone about it and not just read. And so, but I think very much, I love that part where you said, Jenny, about giving the person grace and allowing them to understand in this process, we all may make a mistake, or we all may not know everything that's going on, but the fact that, you know, we're encouraging you to be present, with my husband and what's going on, and that it is a lot to share, and that you've made yourself, vulnerable, and that this is important for you and for them.
Please feel free to put any other questions in that people may have. We'll wait just one more minute to see if anything else comes in. While we're waiting to see if any other questions come in, I did want to let you all know that Medicare open enrollment begins in October, very, very soon. And we are, for the November presentation of the Dementia Lecture Series, we are going to have Anita Alvarez, who works with SHIP and is an expert on Medicare enrollment and the different steps that you can take when you are reevaluating annually if your Medicare plan is still the best plan for you and your loved one. And so it will be a really, really informative presentation. These plans and systems change annually. And so what may have been a great situation for you last year may not be a good plan this year. So Anita is a wealth of information. Obviously, in the presentation, she's not going to be looking at people's individual situations, but can offer the guidance and kind of give you a preview of what you would be getting access to if you were to reach out to SHIP. So that will be a great presentation, and she is a wealth of knowledge. I do not see any other questions. Oh, I'm sorry, I do. It was mentioned earlier in the presentation to keep to a schedule and keep things such as keys in the same place. Is there a way to help my husband get in the habit of keeping things in the same place? I haven't been able to get this message across. Alice, do you want to answer? Do you want me to answer? I've got an answer if you want me to go ahead.
Go ahead and answer.
Okay. Unfortunately, the expectation that your husband is able to start a new behavior or do something differently, I'm not confident in what stage your husband is in, but there does come a point in the disease, especially between the mild to moderate stage, where learning new abilities just becomes not possible. because the brain is changing and processing of information, and short-term memory really starts to decline. And of course, there's a lot of different kinds of dementia, and based on those kinds of dementia, different abilities change at different times. But I think if you have noticed that you have made a recommendation or asked him to do something and you're continuously seeing that he's not doing it, I think that means he's not able to follow those instructions. So I think what that's going to have to look like is when he enters the home, you say, here, let me put your keys down for you. You take that step for him. And when it's time to leave, you will know where they are located, because he would not be able to probably remember a new location where he's putting them to begin with. So I would encourage you to insert yourself into this process to keep track of those things.
Also, you may want to, if they're a little bit earlier on and they're having some difficulty remembering, maybe having a visual cue
Oh, I love that.
as of where it should be, like maybe having a sign that says keys
Keys.
somewhere, may also be helpful if they're earlier on and just having difficulty with remembering where it should be, just having that visual cue.
I love that, Alice. That's great. And something that's like bright, so that it's really visual cues can be very powerful. I love that. I don't see any other questions. We really appreciate all of you taking the time to be a part of the webinar today, and hope that you got something out of it. Again, Alice shared the link in the chat to view the recordings that have happened previously. This one will get uploaded pretty quickly, probably in the next couple weeks. And we will see you guys in November for our next presentation, the second Wednesday of the month, from 12 to 1 p.m. It'll be the same link, but it will be sent out an email and all the regular channels. So we hope that you have a great rest of the day, and thanks again for joining us.
Thank you.